Perfect. There we go. All right. Well, thank you so much for being here, Lisa and Geoff. Today, we're going to talk about couple dynamics and working with them in therapy. Geoff Reddick and Lisa Shroyer, see, there it is.
You got it.
Are emotionally focused couples therapists. So they're going to talk us through their work, their experience, and hopefully give us some insights about working with couples so that you all can decide as master students if this is something you want to go into and maybe have a frame for understanding what happens between couples, because it's a very unique context and relationship to intervene with. So we can start with either of you, but I'd kind of like to hear first any background about yourselves you'd like to share with our first year master students.
Yep, go ahead, Lisa.
Counseling for me has been a second career. I was just kind of a mom and invested in my kids' life, did a lot of, a few little part-time things, but a little life change happened. And I went back to school and got my master's. I think I went back to school at 42, 43. Got my master's and have been fortunately kind of started out learning just where I landed at my internship. EFT was starting to be a pursued model. So I during my internship, I went to an externship. Those are different words that we use, but an externship in Nashville. And then I did my core skills in Louisiana. So I did my training. Then we have, but Arkansas has kind of grown in this, and we have a big community now. So now I help facilitate and do the trainings that we do, and love participating in that. This is a model that you are always going to be growing in. The best thing you can do is continue to expose yourself to the language and people who are further along the journey than you are. And I love doing that, and I love helping people learn it too. So that's kind of been the journey I've been on. I am certified in the model as a therapist and as a supervisor. So it's what I do. I work with a lot of couples. I was told early as an intern that if you can learn to work with couples, you have job security. Because there is always going to be a need for there's always hurting marriages, hurting relationships, and it is very true. Once you kind of develop just some success in it, people are gonna, word gets out. Your satisfied clients, refer people, and you have more business than you know what to do with. And it's very fulfilling also helping couples work through just kind of restructuring their bond, as we say in EFT, being able to go from just a lot of patterns and cycles that are negative, that have just told them horrific things about their marriage and each other, and have them get to a place really back to their true heart, right? Which is with attachment theory is a place that longs to be connected and safe together. So it's been a great model to learn. I'm still learning. I will always be learning. So
wonderful. For you, Geoff?
Yeah, so I teach full-time over here at a university in Northwest Arkansas. This is my third year starting off doing that. I'm a licensed marriage and family therapist in the state of Arkansas, but also in Missouri and Georgia, because I guess I just like to collect licenses at this point. I exclusively work with couples, like in my private practice. So I was trying to think of the last time I've seen an individual, like outside of the context of doing like a split session for EFT. And it's been over 6 years, well over 6.5 years. And so I have just worked with couples. I used to do full-time, what's called intensive marital therapy. And so intensives are a little bit different than weekly, and we can maybe talk about that here a little bit if you want, Katie, to talk about kind of intensives. I know in my master's program, I had no idea what an intensive was. So I'd tell you, I've been doing EFT for a long time, but probably within the last couple of years, really trying to dive deeper into that model instead of just like incorporating things or doing enactments, but actually trying to really live it out, maybe both personally, but also like really trying to invest in the community. So I've gone through the externship. I've done all the core skills. I'm in the process of trying to attain certification. It requires you to submit videos of like your own work. So if you think like, oh, once I get done with my master's program, I never have to watch myself on video again. That's not quite true, I guess, if you want to pursue this model. So I'm in the process of doing that with the trainer and trying to find the right videotapes to kind of reach that point of the certification process. So other than that, listen, I've been married over 9 years. I got a wife and 2 little girls. So I have lots of opportunities to practice EFT, not as a therapist, but just to live it out. And I think sometimes that's the best way for us to learn this model.
Mm-hmm, mm-hmm. Yeah, we have a real focus in our program on self as a therapist. So this idea that our work influences our person and our person influences our work. And the longer you do this work, I don't know what about you guys, but it's hard to disentangle those two things. Sometimes hard to pull them apart because they seem to show up all over the place.
Yeah, and to me, like the thing that stands out to me about going to EFT externships or core skills, at least with the ones that I've been a part of, and Lisa's been a part of a lot more than I have, is like that really comes out. Like it's a lot of the investment is in like you trying to consider like, what's this look like for me? How does this land on me? Was like, so using yourself is like a really big part, at least for us in this model. So like, man, that fits really well, at least for me.
Mm-hmm, mm-hmm. So can you guys talk through, when a couple comes to see you, kind of what are you looking for? How do you understand conflict? I heard you talk a little bit earlier there, Lisa, about like I liked how you phrased it, what the cycle was saying about the relationship. And so I hear sort of this externalizing language of sort of pushing out the cycle as not who we are, but something that happens between us or to us. Can you guys talk a little bit about kind of what you're looking for or kind of what you call it in terms of that couple dynamic?
Yeah. You want me to start, Geoff, or did you
go
want to
for
go?
it. No,
Yeah.
go for it.
At the very beginning, we're really wanting just to kind of notice. You're doing a lot of. I think all models use similar steps in starting out. You're working on alliance. You're, going over safety, all of that. But once we kind of get a little bit into the process a little bit more, we're looking to see what their dance is, what their cycle is. What their moves are, who's a withdrawer, who's a pursuer. That's typically, we have about 85% of couples fall in that pattern. So we're trying to kind of figure some of that out, figure out ways, look for the ways that they protect themselves, right? We know protection comes from when pain might not have words yet, right? So we protect in various ways. And the way one partner protects him or herself cues the way another partner feels, which then, fuels how they protect themselves, right? And pretty soon they get in this cycle. And so we just kind of initially start trying to be curious about that with them. And it's challenging. It's challenging because you never know. A lot of times they come in and you have everything from they're really quiet and maybe both, I don't know, that maybe they just are very low conflict. And then you have high escalated, it's chaotic and crazy. And you have to learn how to intervene in that and create a little bit of order. And all of those things are hard and challenging. And based on your own attachment style, create different challenges for each therapist, because your own attachment style is very present in what you do with your couples also, and is going to get triggered, which is okay. That's normal, right? But it can be challenging too. I'm a withdrawer, so I tend, I have to fight the desire to just not say anything and disengage myself or think, oh my gosh, y'all are, this is hard. So, yeah, I think the first step is just kind of noticing the dance, trying to be able to put some words to it and understand it a little bit better.
Yeah, listen, I agree. Like, and I don't know how familiar, everybody is like in your class, Katie, just with like kind of foundational MFT or systems stuff. But like EFT is very systemic in that we're trying not to get too bogged down in kind of what I would call like the content trap, right? So when couples come in, it's not just couples, like when individuals come in, like they really want to give you a lot of content, right? Like they think that you need more details than like what we actually do need. And so we're trying to sift through like to hear the content, to make sense of the content, but to put it into a process frame. So the process is more like what happens when this happens versus just like, tell me more of your story, right? And so like I think like the systems like saying that comes through my mind like all the time is like all behavior makes sense in its given context. And so like I'm trying to make sense of this person's behavior and their partner's behavior and their dance. And if it doesn't make sense to me, it just means that like I've yet to figure it out. I've yet to really understand where this person's coming from. Like I have a couple I'm working with right now, and the male partner is just his like way of protecting himself is to protest really loudly and angry. Like he's just very, very aggressive, like in just kind of his tone of voice. And he gets told all the time to just like stop doing that. And like people just want to like, hey, you need to manage your anger. We need to like deal with that. Count to 3, like all these techniques that are just trying to teach him to stop his anger. And so like our approach is to not tell him to stop his anger, but to like lean into that and to try to figure out like, man, what makes it make sense that he feels like this is his best move is to just get really loud and be really angry. Like, what is it about their dance or his like person or his like whatever that helps me understand what makes that behavior make sense? And that's a shift like from like a linear perspective to a systems perspective. Because linear is more about like cause and effect and like, well, if we figure it out, then we can stop it. Whereas systems is just like, no, like that makes sense. When he does this, she does that. When she does this, she does this, whatever it is. Like, I think that's kind of my initial mindset is trying, again, like we said, once we get past kind of the initial building rapport and kind of jumping in. But like couples therapy starts fast, like it doesn't take long to get the partners kind of engaged in this, right? Especially when you find out the pursuer. Oftentimes you find out the pursuer because they're the ones that reached out to you in the first place, right? It's not always the case. But like when they start going, that's when I see my students or my supervisees like freeze the most is right off the bat. And a couple starts to just get after it with each other. And I watch my supervisees just kind of withdraw and they just let them go. And they do it for good reasons, right? The same thing, like their behaviors make sense, but they often just either don't know how to interrupt or they think it's rude to interrupt, or they think like if it's communicating something, but like, no, like I'm looking for that energy so that I can use it. Like we haven't started couples therapy until we started to get some of that like dynamic in the room. So.
Yeah. So could you guys define when you say pursuer, kind of what that person would look like? You said they might be the person calling. Maybe they're the loud person in the room or the person who sort of is most active. And then when you look for withdrawer, sort of what are the cardinal signals of either of these positions?
You take it, Lisa?
Sure. I'll give my stab and then you give yours. Okay. I think it's kind of what each person tends to do under distress, relational distress, right? So our pursuer is going to kind of turn up the emotion, the heat, right? They're going to lean in. They're going to want to talk about it. They often have more words, but withdrawers can have just as many words too, right? A lot of times I will, I might ask also, who has kind of like the higher radar in the relationship for assessing distance, right? Because I kind of show this sometimes. I'll say, this is the bond, this is connection, right? And sometimes this happens, this is disconnect when we're in conflict. We're both very aware we're not really connected in this bond, right? We're both aware we're in a huge fight, right? We're yelling and screaming at each other. But also there's this, right? We're working, we have kids, we haven't had a date night, there hadn't been sex lately, right? And what's interesting is our pursuer is going to realize this is happening at upset at the very beginning. And our withdrawer often, if there's not conflict included, isn't going to know we're not okay until the pursuer brings it up.
Yep.
Right.
Yeah.
So the withdrawer just kind of, the withdrawer likes to kind of turn down the volume on the distress and emotion and all of that. So it's kind of how they react and protect, right? Pursuer leans in, withdrawer kind of pulls away.
Yeah, and it sounds like you're also talking about maybe like a tolerance for distance. Like the pursuer maybe has a lower tolerance or sensitivity to the initial movement, whereas the withdrawer is like, this actually feels more comfortable maybe. Or like, I'm really not noticing, I'm not picking up.
Or doesn't even notice it. Yeah, yeah. And I love, that's a great word and a great way to describe it with the pursuer, right? They just have a much lower tolerance. They start getting anxious. They're often, that's not a symptom, but just a trait that we often see, right? Is anxiety with our pursuers. Yeah. It's like, well, it doesn't feel good. It feels like threat, right? To the body.
Yeah. When I ask like my students kind of just to think about like themselves, right? It's like when you think about experiencing conflict with someone close in your life, so whether it's a parent or a caregiver or a partner or whomever, just like what's your kind of strategy? Like, are you the person that's like, ooh, hey, like we need to talk about this. I'm gonna like text them. I want to wait for them when they come home. Like, I don't feel good until we actually like sit down and resolve this. Or like, are you the person that's like, oh my gosh, like I just need a break from this. If they could just give me a minute, then like maybe we could actually sort this out. We don't always have to be talking about the relationship. So kind of just like, have a continuum and like put them in the room, like how far on each side of the continuum they would see themselves. Because what's like the thing that's the same for both of them is they're doing it like as their best attempt to protect the relationship. And so for me, this is one of the reasons Lisa and I really enjoy working with each other when we do some intensives. Lisa identifies more as a withdrawer, I identify more as a pursuer. So we kind of have both of those like energies in the room. As a pursuer, sometimes it's hard to see like my withdrawing partner's strategies as their way of protecting our relationship. Because like I'm like, no, like I'm the one protecting the relationship. I'm the one that wants to talk about it. I'm the one that like has the radar that's making sure that we're okay. But like withdrawers are doing the same thing, like just in their own way. They're like, man, if I could keep us from having this conflict, maybe we would be okay. If I could keep this if I say something, it's going to get worse. So I'd rather just not say anything. That way we'll still be okay. Like they're doing, like we have the same goal. Like our strategies just look so different that like oftentimes when it's hard for us to see our partners like ways, their own strategies and like give it any kind of positive intent. We think that they're, trying to ruin the relationship.
Yeah, I mean, one of my experiences with couples is those different strategies become places I can judge you from. Like, I had a couple in my office on Friday, and one of them was like, you just always want to talk about everything. And the other one was like, well, you pretend everything's fine and it's not fine. Like and so when I hear you guys talk through that, I think of them and like just this back and forth I saw between them and this sort of like pathologizing of the other person about their strategy.
For sure. Yeah, and I think like, and it makes sense why they think that way too, right? So like, it's kind of our job. This is what I love. I love hearing Lisa when we start like our work with a couple, because she does a really good job just kind of like, hey, like, so what's, she explains like, hey, this is what we're going to do in here, right? So there's going to be times when we're working together, we're like, man, our job is to hold space for both of you. And man, there's going to be times when we're working with you and we're trying to lean in and understand what it's like to be you. And like, we want to really make sense of it because we believe like that you're doing that for a reason. But she looks over here, she's like, hey, but I know like it's going to be hard for you to hear that. You're going to be like, no, this is the thing that I want you to fix about my partner. This is the reason we're here, right? And so we said, yeah, but we want to do the same thing for you. Like our job is to hold space for both of them and to try to like identify and make it make sense for why they do what they do, right? So like when I have a couple that's going back and forth like that, I'm trying to lean in with both people to be like, oh, of course, like you want to like pursue and ask for questions and check in on the relationship because man, like if you don't do it, who's going to do it? Like I want to validate that, but like I also want to validate the other person. And I know one of the fears is like, well, if I validate one partner, is that going to like ruin everything with this other partner. And I'll just be honest, like my experience is no, like, because we're trying so hard to like show up for both people that like they get it. They start to, we kind of earn some buy-in from them because they realize like, I'm not only trying to like sit with you and validate what's going on for you. First of all, because we believe it. It's not just like a strategy in therapy where we're like, well, validation seems like it has good results. Like, no, like I really believe that like this makes sense why you do that. But like that other person, we earn it from them because we're going to come back to that person and do the same exact thing. Mm-hmm. I never want to just validate one person's strategies. It's easy for me to validate a pursuer strategies because like that's probably the strategies I use. But like if I only ever validated a pursuer's strategies, like, well, I'm not going to do couples work for very long. Like I have to also really work to validate my withdrawing partner strategies too. So.
Mm-hmm. Mm-hmm. That makes sense.
And ultimately we're trying to get them to talk from these different places. You know, we're going to hold both, work with one at a time. They're working with us first, right? And we're going to try to distill it and organize it in a new way to get them to put words to what, you know, right before I lean in. I mean, what's going on inside? What's the experience like? You know, when your partner goes away, right? What's happening inside for you? So we're helping them put words, and we're using ourselves, right? Bringing ourselves forward and responding and go, gosh, that would really be hard. I just felt that in my chest. This, you know, I kind of hurt for what that must be like. And, you know, do you think your partner really gets this part? How often do you talk from this place? Mm-hmm. Right? Because this is the different conversation, mm-hmm. right? Mm-hmm. That, oh, I really get scared. I really get fearful, you know. Does he ever hear you talk from that place? Wonder what it would be like to share that. And that's, you know, an enactment. We do those. And that's what eventually leads to what we call corrective emotional experiences, right?
Can you talk through that? When you say corrective emotional experience, kind of what you're hoping to create with,
right?
Imagine any of these interventions, but that's sort of the big thing, right, that he does in terms of really moving couples.
Right. A corrective emotional experience is limbic revision, right? When we're in conflict with each other, we're distressed, we're limbic, we're in our amygdala, we have these fight, flight, or freeze. That's the fight is the pursuer, the flight is the withdrawer, right? And so what we're trying to do is help them in session kind of go online with what's happening. And as they talk about it, as they reflect it, as we try to keep it in the here and now, they're in that part of their brain, right? That is, well, they're feeling it. They feel it in their body. And we have all these questions we can ask to keep it online and in the here and now. And then we ask them to, as they distill it, as we've organized it, to share it with their partner in a new, more vulnerable way, to get a new experience. Ultimately, where we're trying to go, and this is a process, obviously, because if they could do it first time we try, they wouldn't even be in our office. Why would they be there? But they can't do it. And we're trying to help them navigate through not doing it well. But we're the goal, the end picture is we can get them to this distilled, softer, more vulnerable place, turn to their partner, tell them about their, you know, their fears, their insecurities, their whatever, and we get an empathic response. We get responsiveness, because that's what pain demands, right? A response. But in conflict, in marital negative cycles, we're not getting responsiveness, right? Because our pain's not really coming forward clearly. Right? It's all up here above the line, lost in content. It's about what it's not about, right? So we help them kind of go down to where they're, again, looking for that corrective emotional experience so that they can get, go from an insecure attachment to a secure attachment, right? By getting limbic revision, enough experiences of this, doing it different, to where safety and security are more the norm than the exception.
So what I hear you kind of describing there is getting to a place where they begin to believe that if they did turn towards their partner, they would get a response, something empathic, as opposed to the usual protection, defensiveness, kind of whatever.
Exactly. And that only happens experientially, right? That's why we set it up in our room. This is an experiential model. It can't be taught, which I'm bummed about, because I'd mentioned it's easier to teach it than have actually be in the moment and have that experiential encounter. But that is what is the catalyst for change, is they experience each other different in session.
Yeah, I would agree. I just want to alter it a little bit from what you said, Katie, like to get them to believe. Like I think belief happens later, right? So like the belief happens after they have repeated experiences that their partner does actually show up differently for them.
Okay.
Right. Like, so I typically don't ever ask like couples to like trust me, because like they don't know me, right? Like they have no idea if we're any good at this. I'm not much like, well, just trust me. I'm like, no, like, and it's the same thing with their partner. Like, I don't want them to just like implicitly trust their partner. They have good reason for like being afraid and for being like, I don't want to risk it one more time to be vulnerable. Because why? Like, because the last 42 times they've tried it, they've gotten stuck in these cycles. So like, I don't just want them to try or to believe it. Like, I want them to experience something new so that they can have new history, like that their brain then goes back to this other moment that like, oh, when I did this the last time, that's what happened. She really showed up, or like he did this. Like, so, and that is, I love that, Lisa. Like, it's one of the differences about EFT. There's plenty of models that like they hope change happens outside of the therapy room. And that makes sense. Like, I get that. Like, and so a lot of the models that are typically more psychoeducational, or I'm even teaching a class, I got MRI kind of on the brain. This is a really early, like brief therapy. Like the impetus for change was like outside of session, but like EFT is all like, no, like we want the change right here in this room. And it's like, we want to do it in front of us, have that new experience here, because that's just what we believe is going to make the difference. So I wanted to say, like, we're talking about like validation is important, but like, it's not just to make them feel better, right? Like validation is always to like try to move to that next deeper level, so that we can then like try to organize and orchestrate like a moment between them. Like, it's good to have moments from like each partner and us as the therapist. And a lot of times we start there, and we like, if it's really stuck and really heightened, like that's kind of how we'll navigate it. Like, our goal is to get to those really deep moments and like pass it to one another. And of course they mess it up, right? Because their system, their limbic system is telling them, it's like the movie Inside Out, where like they're inside, there's just like warning, like, don't do this. The last time you did this, what turned out poorly for you. And so like they're having to fight through all of that to even get to that space. So,
well, that's interesting you say that, because I've had the experience multiple times where I'm doing the thing with the one partner and they're really like getting down to those deeper emotions and we're processing it, and it's the moment for the reenactment, and I have them turn towards, and like they completely shift. Like the moment they make eye contact with their partner, they turn into like a professor, like, and here's what I've been trying to tell you for years. And they like start in this very the emotion almost gets, I don't know how much you guys experience that, but it's sort of interesting to watch just how quickly that shift happens when they face somebody else. So you had talked earlier about like having to walk them through it, kind of knowing that's going to happen. So can you talk a little bit about like what you do at those moments, or how you sort of make those moments okay, right? To some extent too, because you don't want to keep them from trying again.
Yeah, sure. Like, cause listen, well, first of all, like you have to believe that like they did that for a good reason. So again, like we have to know like ourselves, first of all. You can't be like, because I think as therapists, we see vulnerability and we're like, oh no, there it is. Like, we're kind of like a dog with the bone. It's like vulnerability, I got it. And then like, we don't know what to do with it. And so like when we pass, we're like, oh, it's a time for an enactment, and we pass it. What we can't do is like build ourselves up to the point where like, if that enactment goes poorly, like we're in trouble, where it's like, or where we're going to like internally like shame them or be disappointed or whatever, because like that's going to come across like the way I've kind of heard it been taught, which I think makes sense for me, is like anytime we set up an enactment, we just kind of expect blocks to occur. Like I'm kind of I'm more surprised when a block doesn't happen, whether that's from the person that's like supposed to be responding or from the person that we've said. And you can set it up beautifully, right? You're like, could you just turn to him and say this thing that you just said? And like, just go down to this really, and they're like, yeah, I think I could do that. And then they turn and just don't say that at all, right? Like you could, and so what I do first is like, man, okay, so like you can kind of process. I think sometimes we just like, what was that like for you? But if it like was a real major block, we'll just kind of like, I'll use the block as like my next opportunity to lean in, right? So that, I say, help me understand. So when I noticed you turned in to talk to her and I saw something shift right there with your eyes, and you looked down or you did whatever it was that you noticed was the shift, like I'm gonna start right there with that moment, because that's just gonna help me kind of further go in there to better understand like what makes it make sense that they just said something really vulnerable to me, but when they turn to this person, it's not that they just turn to some other stranger. Like they just turn to this person whom they care about the most in the world, whom has hurt them probably the most. And so like I want to like understand that piece and then try to keep moving forward. But I don't know if that makes sense. Like Lisa, I don't know how you would add to that.
Yeah, I like that. I agree. I mean, you can just, it always makes sense. It's always, there's always a good reason for it. Okay, sometimes it just is a marker for, oh, I'm a little bit ahead of them, right? I'm a little bit ahead and thought they could do this, and that was a little too much. That is still something I struggle with, because I love the E of EFT, right? I love the emotion. I want to go there. I want to dive in. But if and Geoff, you're really good. We've talked about this initially with EFT. You have to really just track the behavioral pattern, right? And you're really not getting into the emotion that much, right? And I find myself, I'm that puppy after wanting the bone. It's like, there's some emotion. I know it's there. I'm going to go chase it. But if we go too soon, I mean, they just can't do it. They can't do it. So sometimes it's a marker for me. It's like, crap, I did it again. I jumped a little too soon, or I went past their tolerance, So sometimes it's that. I mean, it can be so many different things,
well,
right? But what I love too about this model is everything that happens is just more information. It's okay. It doesn't mean I failed as a therapist. It doesn't mean they're wrong. It's just more information. It's just like a gathering, continual gathering of data, and information about where they are, where they aren't, what's going on. So it's okay. It's okay if an enactment flops, because it didn't really flop. We expect it to, right? And so we just need to, we have tools. We know what to do when it goes bad. We know how to jump in. The big thing, and we know how, because we've gone to lots of trainings. that would be, I think, the thing about EFT. It is a very hard model to learn from a book. That's why we have trainings. We have, like I said, these externships and core skills trainings, and then supervision to get certified. It is an experiential process also as a therapist. So it's very hard to learn it just by reading it in a book.
Yeah, like I think if that's the case, like if we get a block, right, and it's somebody saying something, and it's like you said, Lisa, that it's just a marker, like, oh, like we're just doing it too quickly. And I'm just gonna say that, like I'm just gonna own it, like I'm gonna take blame, because sure, it's like a one down like maneuver for therapy, but also just because I believe it. Like I'm just like, man, I so appreciate you turning and trying to say that. I mean, that was such a big deal. Like I want to really like affirm the risk, because it was a risk in general to try to turn and say something to their partner. And then I might, depending on the situation, like just kind of own it. Man, it seems like it was just too hard to get there. I mean, that makes so much sense. It's been so hurtful for y'all in the past. Every time you've tried to turn to one another, it's just gotten into the cycle. So it makes sense when that fear kind of comes up. Like I'm just gonna, again, track what just happened in the room, make it okay, affirm it, validate the intention, the effort, and like I'll kind of take blame for it, because I mean it was my fault for maybe trying to go a little bit too quickly.
Yeah, I mean, I hear you guys describing something I think is really important for new therapists, but even for those of us who have been doing it for a long time to remember, which is whatever happens in the room can be useful. and being perfect is really not the goal. But instead staying with and like pacing with the couple is really important in terms of not being too far ahead, not too far behind. And then, taking corrective action, it sounds like, for yourself, if something has gone not so great. But the other thing I'm hearing in there, and when I first started studying EFT, I bought the workbook and like worked through the workbook just to learn emotional language. Because as a Midwestern girl from Stoic Norwegian blood, we don't do feelings. Feelings are not a thing. In fact, the first time I read about EFT, I was like, I'm never doing that. So I'm curious, as you guys think about kind of how you got to EFT, if you're someone who likes feelings and that's something you're really comfortable with versus not, and just how that some of the language in EFT is quite new, given culturally we really just don't do feelings very well.
Yeah, it is. It is something when I go to trainings, any notes, not any, a majority of notes that I take at this point, I am just ripping other people's language. It is about finding your words. I say I love emotion, but I kind of grew up in a home where we didn't use it. We didn't have what I call heart language. There's a lot of love, but there just wasn't heart language. We didn't talk about these things. So I had to learn it. But what's beautiful is, it's very learnable.
Mm-hmm.
We can learn it. We can teach it to others. They can adapt it and adapt to it and start using it also. And I totally agree. That would be a fabulous use of I've seen the workbook and have used it a little bit, but the language that they use is like, these are our therapy phrases, and that's what I would kind of write in my book at trainings that are like great phrases. It's like, I love how you said that. I would never think to have framed it that way. Either seat, whatever, a majority of things, seating attachment, or just multiple different ways of saying things. So it is a different language to learn. Yeah.
Absolutely.
Yeah.
Listen, for me, no, I didn't grow up like talking about emotions. I thought I was going to be a football coach, and here I am as a marriage therapist, right? So most little boys
similar idea.
don't think that they're going to be marriage therapists when they grow up. And that's okay. Because listen, I grew up in the same, I think a lot of us, however we like our environments, there's a pretty consistent message, which is like, hey, that part of you that's emotional, like, it's too much. Like, we just need you to learn to kind of keep that quiet or figure it out yourself. Because like most of our caregivers and parents like didn't have people that did that for them, so they're just doing the best they can. And so I think we had a similar thing. I would say, like, how did I come about it? It's similar to how I knew I was MFT and not like like LPC. Like it just fits with my worldview and how I understand and how I see people heal. Like it's how I navigate like my own relationships when they're really deep, or how we've gotten through something really hard. It's because we're doing the things that EFT talks about. Like when I came out of my master's program, I would not have told you I was EFT. I would have told you I was brief. That was kind of the strategy. I think a lot of people when they come out of master's programs are like love solution focused. That's what MFT programs anyways. And like the brief, because I think it's something tangible for us to hold on to. It feels really safe because like it's more technique driven. At least I think when we misunderstand it to be more technique driven, and so we kind of just hold on to these things we can do. And so I was in my PhD program and doing a case presentation on like how I did brief therapy, and like I had a professor just kind of be like, man, it was great. I don't know why you don't call it EFT. He said, because that's what you're doing in there. He's like, but like, I was just like staunchly against calling it EFT. But so I don't know, like whatever reason, I think maybe it just felt, if I said I was emotion focused, could I face my grandfather and like say that out loud? Right? Like, I don't know if that's like my internal dialogue that I could say. It's already tough to just be a therapist, right? Like in a family where they're just like, we don't talk to people about that. So to say that I was like emotion focused, like maybe that's what it was. I have no idea. But like when I just kind of like dive in and try to understand who I am, how my relationships work, it just fits, right? Like it just seems to fit and makes the most sense for my worldview and how I see relationships matter. It's just, when it boils down to it, like we're created to like be vulnerable with people. And like when we're vulnerable, like that should get a response. And like, I know when I'm vulnerable and get a response, like that's when I feel close to people. And that's all EFT is like getting vulnerability and helping them respond to it. And it, like, to be honest, like sometimes it is just that simple. I know it's complicated for how we get there, but really that makes sense to me. It's just like, oh, vulnerability and responses like that I can work with.
Yeah. So I'm curious, this will be a question my students will ask me, I can almost guarantee it. Are there any kinds of couples or individuals you would not recommend EFT for? Is there a exclusion criteria or something you look for that goes, those folks can't do this? Because I certainly hear like concern from people, and then they have lots of reasons why they don't work with couples, which ends up excluding almost everybody. So I'm curious if there are things you guys look for, or not really, you sort of try it out and see how it goes with most couples.
Yeah, we call those Contra Indicators, and they're a little tricky because it doesn't necessarily mean we can't move forward. It means we have to move forward differently. Safety's always an issue. Really, there's four. They're known by the A's: ongoing affairs, ongoing abuse, ongoing addiction, and this isn't an A. It's conflicting goals. Right? One person wants to save the marriage. What, Geoff?
Agenda. Yeah.
Yeah. Conflicting agenda. Right? One wants to work on the marriage. The other one's just, showing up to check it off a list. So those are what we're kind of assessing for, to see where we are, at what level of safety is there, if any of those are present. And then there, you can kind of do a little pre-EFT. You can do EFT a little different, where you're not going into vulnerability as much. You're just kind of tracking the cycle a little bit, seeing what happens, much less enactments, just kind of clarifying for them, but still using all the interventions that we use, minus, the enactments and getting them vulnerable. We don't want to set someone up to be vulnerable and it get used against them, them get hurt in the process. So we're going to try to protect them, obviously.
Sure.
Yeah, listen, I would agree. And so the agenda one is, and that's couples therapy in general, I would tell you. But sometimes you don't know about that until it's over. Like, I'll be honest, like you can kind of have an inkling, like, man, like it doesn't seem like things are going well. Like we keep feeling stuck. Like I just had this happen to me. I was working with a couple for, I don't know, 5-6 months. And it just like, we were struggling to gain traction. It kept feeling like I kept running into something. And the male partner, like one night was like, well, I got something I want to talk about. I'm not sure I'm ready. So I'm trying to like validate and have that make sense. And he's like, well, I don't think I'm ready tonight. And I was like, great, we'll try to do that next week. And the female partner was really understanding. She's like, you take your time. I just want to be here for you. And then she texted me like an hour later and she goes, well, he asked for a divorce, like right after they got off our session. And like, he had been kind of evidently, like we come to find out, like he kind of made that decision 5 months ago. And it just has kind of been going through the motions. And it's, you can kind of think that that's happening. But like, of course, like when we're doing EFT interventions and trying to get vulnerability, it like just kept running into a wall, and it's hard to really like vet that one out, I think sometimes. Whereas, affairs, which again, people can hide affairs, they can hide abuse. So any of this like relies on us trying to really get, I don't know, like authenticity from people, but like how much of that can we guarantee if they don't tell us? That's just part of the difficult part of our job, I think.
Yeah, I mean, those 4 things are not things people usually offer up willingly. I mean, those are, unless something's been, like I've worked with couples where it's post-affair and then it's sort of, that's why they're there, it's on the table, or somebody's in recovery and that's why they're coming. But if it is ongoing, it is harder. It's not something always people lead with. And even if you ask, they don't always, they're not.
Yeah, and I think one of those things that like we try, you do as best as you can. Like for us, most times in EFT, if you like know your EFT and you're going to do it, like I'll meet with a couple the first time, but like after that, we're going to try to get some individual, like an individual session with each person to kind of get some attachment history. So for Lisa and I, even when we do like intensives, when we're just going to be with this couple for a really long period of time, what we found to be really helpful is on the front end, we still try to do like a Zoom individual session with each partner, just to kind of do some of this. And I think how you go about assessing that matters, right? So like if I just come out and say like, hey, are y'all hitting each other, right? Like in front of them, like probably not gonna get as much information as if I'm like with each individual, or if I just kind of roll with it. I'm like, hey, so when y'all have conflict, help me understand what that's like. Sometimes when couples have conflict, they slap, they hit, they throw things, they stand in doorways, they call each other names. And I'm just gonna rattle off like 14 different things that could meet criteria for violence. But if you just say, are you violent? They're gonna be like, nah, like we're not violent. They're like, oh, but no, like I time her when she comes home, she hits me, like all those things might be happening. And so it's just a matter of like how we assess and like, do we kind of ask questions in a way that like we're gaining the relevant information. But sometimes you just find out stuff, and like that's when we have to pivot and take it as we go.
Right. Yeah, I was telling my students that invariably you'll have clients where you find something out 5 months in, 8 sessions in, that you're like, that would have been helpful 8 sessions ago. But that's just part of the work. It's not necessarily even anything you did wrong necessarily. It's just kind of what happens sometimes. Yeah,
I had this Ryan's the one that said this, Lisa, like back when I was in my master's program. He said, hey, like, are you ever curious when you guys go out in the morning and you see like garbage trucks? He's like, man, there's always around trash. Have you ever noticed that? Are y'all curious about like why these garbage trucks are just around trash? And there was like, well, no, like that's their job, is to pick up trash. He's like, yeah, exactly. He's like, you're a therapist, so just expect things to go wrong. People are hurting, they're stuck. Like, so that's your job. Don't be surprised when like stuff comes up. It's because like, man, that's what we signed up for. Like those are the people. Like that's us. So that has always helped me, I think, just think of it that way.
Yeah, you're invited, when you work with couples in particular, you invite in the conflict, you invite in all the stuff, right? And so you're going to see it all. It's going to show up. Yeah.
Which is really important, because you have to know how you navigate conflict, like in your, just in general, but like especially with your close relationships, because that's going to come up for you. Like just because it's between 2 other people doesn't mean it's going to feel good for you. Like those things are going to come up inside. And if your response is typically to just be like, oh no, I don't know what to do in conflict, like that's going to happen with couples. It's not like we just, it magically disappears. So like we have to be really good at like paying attention to that for ourselves first, and doing it well in our own lives, so that when conflict comes up with other people, we actually use that. I mean, that's when we get to start therapy with couples. Like it's hard for me to start therapy unless I see some conflict, a little bit of juice, right? Like I need something in there. But if I can't handle conflict, then it couples is scary, right? Like it is when people just go to work with individuals, because and it makes sense. Like they really struggle when they see people fight. And not that I want couples to just fight, like it's our job to get in there with them. But that's what I see knock them out of couples the most.
This is the 6-year-old. Oh, you want to say hi? No, I don't want to say hi. This is JoJo.
Okay. Hey, JoJo.
What's up, JoJo Bear?
Yay.
Hi. So I'm curious. I want to ask, I have like one final question, and then if there's anything else you guys think is important that we haven't talked about yet. But one of my questions was, if you had some advice for some early therapists who are thinking about doing couples work, what would you encourage them to think about or work on now as they're sort of in this beginning stages?
I'll kind of go first here, Lisa, because I'll be curious to hear kind of what it is for you. Like for me, I would work a lot on trying to like assess interactional sequences. Like I think, so that'd be one thing, and I'll come back and talk about that. And the second one is validation. I don't want to forget that one. So like it's actually really, it's a skill to learn for how to assess patterns in sequences. And that's systems, right? That's EFT, is us trying to, so when you mean, when you do this, what's it like for you? Okay, so when you do this, what's it like for you? You do what? Oh, and so then when you do this, what does she do? Like that's for families and couples. It's just getting really good. And if you think you have it, you're not there yet. Like you still need to go probably 3 or 4 more turns around. And I think so because that is getting you process information and not content. Like I don't need to know what y'all had for dinner last night when you're telling me about the conflict. Right. But they think like couples will tell you, it's like, well, we're in the kitchen, you're wearing that apron, and I never liked that apron. And you know how I feel about that apron. And now we're about the apron and 3 Christmases ago about who bought the present. And like, that doesn't have any bearing on us. And like, we're therapists, we're nice, we'll let you talk. But like, instead, like, can we get better at trying to navigate process conversations? And the second thing I think, Katie, is validation. Like I have supervisees that are like, hey, so when do I know like I've had too much validation? And I'm like, I'll tell you when, because it's not going to happen, right? Like I've yet to work with an individual or a couple where they're like, hey, could you just, I feel like you're getting me too much right now. I feel like you're attuning too well. I'm feeling over validated. Like I just don't see that happen. So my rule for my supervisees is always like, before you ask the next question, validate what the information you just got, because we can get into a habit of just question after question, and it turns into an interrogation, and they don't mean to. It's not like that's what their goal was, but they're so concerned about what do I say next? What do I do? What do I ask next? That they've left the room. And instead, like once you hear them say like, oh, well, man, when he gets angry, like I just go to I withdraw. And you be like, of course you withdraw, because like when he gets angry, like it's what for you? Like you want to like really like affirm and validate them before you're like, oh, so when you withdraw, well, why do you do that? Or have you thought about another strategy? Or have you tried a date night? Or whatever questions we ask them, validate.
Nice.
Yeah. I love it, Geoff. I agree. Validation's huge. I guess what I'd want to tell master's level, beginning, maybe even before internship is, and I mean this so honoring and respecting, and I don't mean this demeaning at all, but just for it to be okay. This is a hard part too, for it to challenge you to be okay with where you're at. And you're brand new at something that is going to require new language, and it's only really learned experientially. And that's hard, because guess what? As a withdrawer, my worst place in the world is feeling like I failed. And guess what? At first, it's going to feel like you don't know what you're doing, and that's okay. When it just celebrate every little, it's like, I did some validation today in session. That was awesome. I did it, and I can learn more, right? But just celebrate where you are, have good support. Watch, the best thing you can ever do is to watch your video. Do it a lot. It is painful, I know. Pick an intervention, pick validation or attunement, right? Or reflection, right? Concentrate just on one at a time, right? You remember, you're probably hardest on yourself than anybody else is. And anything you do, any thing you do, connecting, bringing your authentic self there, being an ear, listening, responding. I mean, that's what connection, that's how change happens. So be kind to yourself. And it's a great model if you want to pursue learning it. I would say it's life-changing. It's life-changing for you as a therapist, at least it has been for me and all my peers that I've talked to. It's life-changing getting to see what can potentially happen in front of you. It is just a really great, I'm a little biased, as you can tell, but I think it's a great model. So
that's why I reached out to you guys. I wanted the bias. This totally fits. The other thing you're reminding me of is just how compassionate EFT is. So like your advice there was so EFT. It was like so full of compassion for like where we are and being present with ourselves where we are, and that being okay and being enough, right?
Yeah, exactly.
And I think that's so important. For me, like EFT brought this whole language around how to be where you are, and that validation and that compassion for self and for other is such a big part of, I feel like the heart of EFT, in terms of that's part of what you're bringing to the room too.
Yeah, and you can get the techniques. It's a great model. It's really helpful, like to have a roadmap to know the 5 steps of the tango, or to practice TEMP. Like, it's not like you get lots of practical strategies for what to do in the room, but like without the foundation of like that kind of heart of it, it doesn't matter what technique you use. Like, it's not going to really bear out for you. You'll quit the model, and maybe then that's okay. Like, maybe you figure out something else is better for you, but like, you have to have that kind of first. Like, the thing that changed EFT for me, I was at it as externship or core skills 1, and like something happened. They were talking about withdrawers, and like I saw my wife in such a newer way. Somebody had said like, who do you start with? And they were, I think it was Ryan or George Fowler, and they said, start with the withdrawer. And he goes, because nobody else is doing that. Nobody else has done that for them before. And I was just like, oh, like I just crying, because I was like, that's my wife. Like, nobody started with her. I don't even start with her. And like, it was just transformational for me, like to like have that personal impact. And then like as a therapist, then I can pour out myself even more now.
Yeah, that's a good example of the way that like when the model means something to you personally and cracks you open a bit more, I think it becomes more authentic at that point, because it's sort of like running in you as well, versus like feeling like you're putting on something or having to perform a particular way.
And I know that's what people tell master students all the time. At least that's what it's been like over here, and what it was like for me is like, use the theory that fits best with who you are. And his master's is like, I'm just trying to pass some exams. I guess in Arkansas, you have to go in front of an actual like state board and like go through an interview, and they have to defend a model. So it's like very intimidating. So our students are always just like, how can I pass the state board? That's less about like, let me find the one that's true for me. Right. So like, and again, like what Lisa said, like totally normal. That makes a lot of sense. Like, we're trying to get through it. And like, as you persist, like try to find that thing that does fit with who you are. Ryan told us not too long ago that he feels like the burnout, he rarely now meets therapists that have been practicing longer than 10 years. Because once we get to like 10 years, like people just kind of decide they're going to do something else. And a lot of it is, I think, because like we don't pay attention to us, and we don't find these models that really do work with couples, right? Like, you'll burn yourself out quick if you try to work with couples but don't have like a model that seems to work, because you'll ultimately take blame for it for yourself, and none of us want to like wake up and deal with that every day. So
and I don't know if we've used this word. If we have, sorry, my withdrawer self zones in and out every now and then. But what I love about EFT is it gives us the map. It gives us a working map to work with couples. So it's always easier to go somewhere when you know where you're going, right? And so we know what to do in these different situations that come up with couples. And it takes, I would say, a good solid 5 years to feel like you know what you're really doing after you've gone through all the training, and that's if you keep kind of being immersed and hearing it again and again. But I think that's going to be any model maybe that you use. It just takes a while. And that's kind of going back to what I said a little bit ago. That's the hardest thing about what's ahead of you, is being okay with where you are. You are exactly where you're supposed to be, and that's okay. But kind of being able to show yourself that self-compassion, because being okay with knowing that I've got a long way ahead is challenging. That's hard. We want to be where we're going to be in 5 years, but we're where we are right now. But that's enough, and that's good, and it's where you're supposed to be. And lots of change can happen exactly where you are. So
I feel like we should end on that note, because that's beautiful. I really appreciate that. I think that's a really important thing for all of us to know, but I think particularly for our master students, they're so excited and usually, have all these plans for themselves, and it's easy to get ahead of yourself and be self-critical. So that message of compassion and being where you are is really important. Well, I really appreciate both of your time and your talent and your own passion for this work. So thank you so much for taking time out of your week to talk.
Absolutely. Anytime, Katie.
Yeah, you're welcome.